The Kausay Wasi Clinic is located in the Sacred Valley of the Incas in Coya, Peru, 45 minutes from the beautiful city of Cusco. Although very beautiful, the climate in the Andes is very harsh, especially for those who live in precarious conditions. Potable water is not routinely available, and basic health services are minimal. Most of the clinic's patients are extremely poor and live under the poverty line on subsistence agriculture and are subjected to a limited and less than adequate educational system. Since opening in 2005, the clinic has provided healthcare services to 126,000 patients, offering 9 distinct health services 7 days a week, including general medicine, consisting of diagnostic and preventive care and minor surgeries. Dental services, including prophylaxis, root canals, fluorization, x-rays, and prosthetics. Gynecology, including Pap tests, pre- and postnatal care, and techniques for early detection of breast cancer. A laboratory which performs biochemical, microbiological, and urinalysis tests, ultrasound, x-rays, wound care, physical therapy, and prosthetics. This program is offered in our prosthetics center to the more than 60,000 physically handicapped individuals in our area. And produces prosthetic hands, arms, legs, and feet. Patients who could never afford these services on the local market obtain them at the clinic for the cost of the materials or free if they are unable to pay even this amount. The clinic has the only pharmacy in the district where patients can obtain quality medicines at very low prices compared to other pharmacies in the area. The clinic processes and provides free potable water for the consumption of our patients and neighbors, saving expensive and scarce resources otherwise used to boil water. Another high priority program of the clinic is our Rural Health Program, which provides health care and preventive education to the most rural communities populated by Peru's native population. Our rural nurse treats basic health problems, teaches personal hygiene, the importance of maintaining a clean living environment, good ventilation, and maintaining animals separate from the living quarters. The nurse also identifies patients with complex problems for treatment at the clinic and treats children for parasites and malnutrition. Our rural nurse and clinic staff identify extremely poor families for our Adopt a Family program. Selected families are adopted by American donor families, which, for a total of $200, covers the entire family's medical expenses for a full year. To date, 78 American, Canadian, and European volunteer medical teams have performed over 1,500 free operations at the clinic, including gynecological, orthopedic, ears, nose, and throat, plastic surgery, and general surgery cases. These surgeries are otherwise very expensive and totally out of the economic reality of the clinic's patients. Additionally, the clinic has sent 6 patients to the United States and 7 to Lima for surgeries that could not be performed at the clinic at no cost to the patients. The most important characteristic of the clinic is that patients are treated with dignity, respect for their traditions, customs, and beliefs. Clinic personnel speak Quechua, the native language. No patient is ever turned away for lack of funds. The clinic provides employment opportunities for small entrepreneurs which provide meals or lodging to patients and their families. thereby contributing to the local economy. The clinic is totally self-supporting, thanks to the small contributions made by clinic patients for services provided. Visiting medical teams cover all their expenses, including transportation, lodging, and necessary medical supplies. Given the continuing demand for services, the clinic hopes to grow and offer even more services for our patients. We hope to accomplish this by acquiring newer and better equipment through the generosity of individuals, companies, and fundraising.
From Virginia. I'm Dr. Frank Villa, and we're just here to do whatever we can to help the eye care needs of the area.
What do you think is the type of impact of a program like this?
The people here are just wonderful. They're extremely appreciative of everything we do. To be able to give them glasses that can help their daily needs.
Some of the most wonderful people I've ever met. They're very nice and they've been kind to me, and I've tried to be kind to them.
They're some of the most wonderful people I've ever met in my life. They're very kind and considerate and appreciative of everything we do. You know, I never got so many hugs and kisses in a couple of days of my life.
Seeing about 250 patients a day, doing a full eye exam on the people. We're doing visual acuities, screening for eye disease, treating glaucoma, arranging cataract surgeries for the doctors who are going to come later.
What we do is that we do refraction, which is check the glasses to see if a person needs a prescription for reading glasses, both for far and for near.